Welcome to the Dr. Izzy's Medical Podcast channel.
Question: how do macrolide antibiotics influence cytochrome P450 activity? Answer: decrease. Question: how do nitroglycerin and isosorbide dinitrate change preload? Answer: decrease. Question: how do NSAIDs influence furosemide action? Answer: inhibition. Question: how do Plasmodium spp cause anemia? Answer: RBC hemolysis. Question: how do reversible competitive inhibitors change Michaelis constant? Answer: increase. Question: how do reversible competitive inhibitors change Vmax? Answer: no change. Question: how do sulfonamides influence the activity of cytochrome P450? Answer: decrease. Question: how do the third generation atypical hypnotics known as Z-hypnotics affect sleep? Answer: shorten sleep latency, prolong sleep time. Question: how do theophylline and caffeine affect adenosine action? Answer: blocks adenosine action. Question: how do thiazide diuretics change urinary calcium levels? Answer: decrease. Question: how do thiazide diuretics change urinary potassium levels? Answer: increase. Question: how do thiazide diuretics influence calcium levels? Answer: increase. Question: how do TNF-alpha inhibitors influence infection risk? Answer: increased risk, especially with TB, as TNF is needed to activate macrophages and induce phagocytic destruction of microbes. Question: how do triglyceride levels change following the administration of bile acid resins or anti-hyperlipidemics? Answer: slight increase. Question: how does a competitive antagonist change efficacy of a drug? Answer: no change. Question: how does a competitive antagonist change the potency of a drug? Answer: decreased, therefore, curve shifts to the right. Question: how does a non-competitive antagonist change the efficacy of a drug? Answer: decrease. Question: how does a partial agonist change the efficacy of a drug? Answer: decrease. Question: how does acute alcohol abuse influence cytochrome P450 activity? Answer: decrease. Question: how does allopurinol affect the concentrations of azathioprine and 6-mercaptopurine? Answer: increases both, as both are normally metabolized by xanthine oxidase. Question: how does allopurinol influence the toxicity of azathioprine? Answer: increase. Question: how does amiodarone influence cytochrome P450 activity? Answer: decrease. Question: how does an irreversible competitive antagonist change the efficacy of a drug? Answer: decrease. Question: how does aspirin affect acid-base balance? Answer: initially causes respiratory alkalosis, metabolic acidosis superimposes on top after. Question: how does aspirin inhibit platelet aggregation? Answer: inhibition of thromboxane A2 production. Question: how does atropine influence gastrointestinal motility? Answer: decrease. Question: how does atropine influence gastrointestinal secretions? Answer: decrease. Question: how does atropine influence respiratory secretions? Answer: decrease. Question: how does atropine influence urinary urgency and cystitis? Answer: decrease. Question: how does bleeding time change after aspirin administration? Answer: increase. Question: how does bleeding time change following aspirin administration? Answer: increase. Question: how does blood pressure change with epinephrine administration after alpha-adrenergic blockade? Answer: decrease. Question: how does blood pressure change with epinephrine administration before alpha-adrenergic blockade? Answer: increase. Question: how does blood pressure change with phenylephrine after alpha-adrenergic blockade? Answer: no change, phenylephrine's action is suppressed by the alpha blockade. Question: how does blood pressure change with phenylephrine before alpha-adrenergic blockade? Answer: increase. Question: how does carbamazepine influence cytochrome P450 activity? Answer: increase. Question: how does chronic alcohol influence cytochrome P450 activity? Answer: increase. Question: how does cimetidine influence cytochrome P450 activity? Answer: decrease. Question: how does ciprofloxacin influence cytochrome P450 activity? Answer: decrease. Question: how does decreased blood solubility influence induction and recovery time of anesthetics? Answer: shorter induction and recovery. Question: how does digoxin affect vascular tone? Answer: slight increase. Question: how does digoxin change cardiac contractility? Answer: increase. Question, how does digoxin change heart rate? Answer, decrease via vagal nerve stimulation. Question, how does phenoldiprem change blood pressure? Answer, decrease via vasodilation, decrease TPR. Question, how does phenoldiprem change natriuresis? Answer, increase, it causes renal vasodilation. Question, how does furosemide influence calcium excretion? Answer, increase. Question, how does gemfibrozil influence cytochrome P450 activity? Answer, decrease. Question, how does growth hormone facilitate hyperglycemia? Answer, induction of hepatic gluconeogenesis, decreases insulin sensitivity. Question, how does grapefruit juice influence cytochrome P450 activity? Answer, decrease. Question, how does griseofulvin influence cytochrome P450 activity? Answer, increase. Question, how does griseofulvin influence P450 activity? Answer, increase. Question, how does hydralazine change after load? Answer, reduction. Question, how does hydrochlorothiazide change calcium levels? Answer, hypercalcemia. Question, how does hydrochlorothiazide change glucose levels? Answer, hyperglycemia. Question, how does hydrochlorothiazide change lipid levels? Answer, hyperlipidemia. Question, how does hydrochlorothiazide change sodium levels? Answer, hyponatremia. Question, how does hydrochlorothiazide change uric acid levels? Answer, hyperuricemia. Question, how does hypercalcemia affect digoxin action? Answer, increase. Hypercalcemia is additive onto digoxin and will increase cardiac contractility alone. Question, how does hypercalcemia alter digoxin action? Answer, additive. Calcium has inotropic effects itself. Question, how does hyperkalemia affect digoxin action? Answer, decreased digoxin action. Question, how does hyperkalemia affect the toxicity of class 1 antiarrhythmics? Answer, increased toxicity. Question, how does hyperkalemia alter digoxin action? Answer, reduction. Hyperkalemia leads to dephosphorylation of the ATPase subunit. Question, how does hypermagnesemia affect digoxin action? Answer, decreased digoxin action. Question, how does hypokalemia alter digoxin's effects? Answer, digoxin has a greater effect as it competes with potassium ion for the binding site. Question, how does hypokalemia influence digoxin action? Answer, increased digoxin action. Question, how does hypomagnesemia affect digoxin action? Answer, increased digoxin action. Question, how does increased lipid solubility influence the potency of anesthetics? Answer, increased potency. Question, how does irreversible competitive inhibition change Michaelis constant? Answer, no change. Question, how does irreversible competitive inhibition change Vmax? Answer, decrease. Question, how does isoniazid influence cytochrome P450 activity? Answer, decrease. Question, how does isoproterenol influence blood pressure? Answer, decrease. Question, how does isoproterenol influence heart rate? Answer, increase. Question, how does ketamine change cerebral blood flow? Answer, increase. Question, how does ketoconazole influence cytochrome P450 activity? Answer, decrease. Question, how does lidocaine change the refractoriness in depolarized cells? Answer, increase. Question, how does lidocaine change the refractoriness in normal cardiac cells? Answer, decrease. Question, how does linezolid affect lactic acid levels? Answer, increase. Question, how does mirtazapine change serum cholesterol levels? Answer, increase. Question, how does modafinil influence cytochrome P450 activity? Answer, increase. Question, how does nevirapine influence cytochrome P450 activity? Answer, increase. Question, how does non-competitive inhibition change Michaelis constant? Answer, no change. Question, how does non-competitive inhibition change Vmax? Answer, decrease. Question, how does norepinephrine change blood pressure? Answer, increase. Question, how does norepinephrine change heart rate? Answer, bradycardia. Question, how does phenobarbital influence cytochrome P450 activity? Answer, increase. Question, how does phenytoin influence cytochrome P450 activity? Answer, increase. Question, how does platelet count change after the administration of thrombolytics? Answer, no change. Question, how does PT change following aspirin use? Answer, no change. Remember, aspirin only affects platelet aggregation. Question, how does PT change following the administration of thrombolytics? Answer, increase. Question, how does PT change in after aspirin administration? Answer, no change. Question, how does quinidine influence cytochrome P450 activity? Answer, decrease. Question, how does renal failure influence digoxin toxicity? Answer, increased toxicity as digoxin is renally excreted. Question, how does rifabutin influence cytochrome P450 activity? Answer, no effect. Question, how does rifampin influence cytochrome P450 activity? Answer, increase. Question, how does rifampin influence cytochrome P450 activity? Answer, increase. Question, how does ritonavir influence cytochrome P450 activity? Answer, decrease. Question, how does St. John's wort influence cytochrome P450 activity? Answer, increase. Question, how does testosterone change HDL levels? Answer, decrease. Question, how does testosterone change LDL levels? Answer, increase. Question, how does the administration of beta blockers change blood pressure? Answer, decrease. Question, how does the administration of beta blockers change cardiac contractility? Answer, decrease. Question, how does the administration of beta blockers change end-diastolic volume? Answer, increase. Question, how does the administration of beta blockers change ejection time? Answer, increase. Question, how does the administration of beta blockers change heart rate? Answer, decrease. Question, how does the administration of beta blockers change myocardial oxygen consumption? Answer, decrease. Question, how does the administration of nitrates change blood pressure? Answer, decrease. Question, how does the administration of nitrates change cardiac contractility? Answer, increased via reflex response. Question, how does the administration of nitrates change end-diastolic volume? Answer, decrease. Question, how does the administration of nitrates change ejection time? Answer, decrease. Question, how does the administration of nitrates change heart rate? Answer, increase via reflex response. Question, how does the administration of nitrates change myocardial oxygen consumptions? Answer, decrease. Question, how does the drug allopurinol affect azathioprine and 6-mercaptopurine toxicity? Answer, increased. Allopurinol inhibits xanthine oxidase which metabolizes both azathioprine and 6-mercaptopurine. Question, how does the PR interval change as a response of class 2 antiarrhythmic action the AV node? Answer, elongated PR interval.
Thank you for listening Dr. Izzy's Medical Podcast Series. If you want to support this project, please subscribe the channel and like this video. Thank you.